What I was interested in was what is happening in 2016 as far as, the strength of the recommendation to give prophylactic cranial irradiation to small cell lung cancer, and does it vary with the age of the patient? And as well, I'm starting to look at what's the difference in the recommendation according to specialty. If you're a radiation oncologist, are you more or less likely to be having a strong recommendation for prophylactic cranial irradiation, which I'll refer to as PCI now. And then the other thing I asked in this survey was whether if you could picture yourself having the diagnosis of limited small cell lung cancer and you were faced with the decision to have PCI or not, would you in fact have it? And so what I found was that, starting from the beginning, that the strength of the recommendation is still fairly high, that physicians are recommending prophylactic cranial radiation. And yet it does now break down to how old the patient is. So they're very likely to recommend PCI if the patient is 50 years old, but for patients who are 70 years old, they're less likely to recommend it. And I think that relates to the fact that there's more literature that's out there now about the long-term effects of PCI on memory and concentration, the neurocognitive side effects. So that kind of makes some sense. And then I was also interested to see who would have it themselves, and the majority, 76%, would have prophylactic cranial irradiation, and both medical and radiation oncologists were equally likely to have it themselves.